I'm Matthew Witry, and on behalf of my other co-authors from the University of Iowa College of Pharmacy, we're going to be talking about training student pharmacists in suicide prevention as part of a pharmacotherapy course. QPR was our main training that we used for these students, and it's 90 minutes, and it's designed to teach skills needed both for identification of people at risk for suicide and how to ask the question, are you thinking about suicide, and then refer them to services. We believe that training people in QPR, including students, can prepare them to intervene with not only patients that they might encounter in the workplace, but their peers as well while they're in pharmacy school or in their personal lives out in the community. Studies show pharmacists and college students interact and socialize with people that may display the warning signs of suicide. Our objectives for this project were to assess student pharmacist attitudes of self-efficacy and reluctance and see how those change. Test the relationship between post-training self-efficacy and their self-reported likelihood to intervene. And report student experiences hearing concerning statements concerning suicide ideation at work and in their personal lives. Our methods, we did pre and post electronic surveys that were anonymous for the second-year students that were enrolled in a neuropsych integrated pharmacotherapy course. A social worker provided the QPR, and we also had a VA pharmacist facilitate a discussion section. Surveys that assessed confidence, a knowledge reluctance measure, and both of those used established measures. Descriptive and ordinal regression analyses were done. All students responded to both surveys. Students showed significant improvements in their confidence and in their knowledge and reluctance attitudes related to suicide prevention. 3/4 of students reported being very or extremely likely to intervene, which we are really pleased to see the next time they see warning signs of suicide. So here are those example items of the self-efficacy scores. And here are the knowledge and reluctance items. And here we wanted to see disagreement. So higher scores are more conducive to intervening. Confidence was significantly associated with future likelihood to intervene. And students reported being told concerning statements suggesting suicidal ideation both in their personal lives and at work. So here's a regression analysis that shows really that post self-efficacy had a strong impact on someone's likelihood to intervene the next time you encounter someone showing warning signs. Future work is planned to reinforce suicide prevention learnings and skills. We're thinking about using simulation and observational assessment. Research also is needed to study the impact of the training on actual mental health crisis intervention and practice. Engaging community organizations and psychiatric pharmacists in the trainings, it may have an added benefit because we're exposing students to different models and perspectives. So schools of pharmacy should consider adding one of the numerous suicide prevention education models to their curricula. And that, again, that's both so that we can train pharmacists to be in that public health role, and we think students might be able to use some of these skills with their peers. Training student pharmacists in QPR and engaging with psychiatric pharmacists, it was associated with a significant improvement in confidence and decreased reluctance for suicide intervention. Self-efficacy was positively associated with likelihood to intervene. Students reported being told concerning statements suggesting suicidal ideation, both in their personal lives and at work, which I think just highlights the importance of this work. So please feel free to contact me. I'm happy to chat more about this. Thank you.